July 2013 is a time for celebration. Summer seems to be lasting for more than one day. Britain is tasting and maybe will continue to taste considerable sporting success, as you might have gathered in the last few days. Next week, hundreds of our students will graduate, which is a special day for them, and it's Spectrum's 5th anniversary. So July 2013 is a time for celebration. Next year, in 2014, the university celebrates its 50th anniversary. So Spectrum has some way to go, but if its recent and current trajectory is anything to go by, then it will continue to thrive and be one of the jewels in the universities and the faculty's crown. Spectrum sits organisationally within the Faculty of Health and Medicine, which I'm very proud and privileged to be Dean of. The faculty itself is only 5 years old, having brought together colleagues from across the social and biomedical sciences to engage in what I think is outstanding policy-led research and high-quality teaching. Within the faculty, we also offer undergraduate medical education, where we expect very soon, within a year or two, to be delivering an independent programme. We will be our own independent provider of medical education, and therefore training the next generation of doctors. And what we know now is that students who start in September, as well as the current first years, those who are just finishing their first years, they will all graduate in 5 or 4 years' time in some cases, with a Lancaster University degree, and that makes us very proud. But the faculty is small in relation to similar entities at other universities, and because of its size, my strategy has always been to try and specialise in a few key areas, rather than spreading ourselves too thinly. We just can't hope to cover all bases. So our research coalesces around 6 main themes across the faculty as a whole. So these would be public health, ageing and end-of-life care, infectious disease, biostatistics and epidemiology, cancer research, and mental health. And each of these is itself, of course, a very broad research area. And again, we have to specialise. So, for example, in claiming some expertise in mental health, we've had a particular focus on bipolar disorders, an area in which Spectrum has been crafting a national and increasingly an international reputation for making a difference, particularly in the area of psychological therapies, evidence of which you see all around the room. Now, 5 years ago, I don't think any of us could really have expected it to have grown in size and reputation quite so rapidly. And for this, I have several people to thank. Firstly, a very generous donor who wishes to remain anonymous, for their vision and commitment, and without whom, categorically, there would not be a Spectrum Centre. And this donor has continued to take a very keen interest in the work of Spectrum. And for that, we owe the donor, you'll notice I'm not even identifying her or his gender, we owe that person a considerable debt of gratitude. I'd also like to thank, secondly, other generous donors and funders of research who've recognised the importance of this key area. Thirdly, I want to pay tribute to Steve Jones and Fiona Lollen, co-directors of Spectrum, for their tireless work in helping to realise this vision. And lastly, I want to thank all of those working with Fiona and Steve for the effort they put into the numerous research projects, evidence of which you see in the posters and elsewhere. And also to those who are helping now to deliver a very innovative taught doctoral programme in mental health. So, ladies and gentlemen, thank you for attending today's event and for your interest in spectrums research. You're going to hear shortly from some of the experts, including one and possibly more than one, who brings an important user dimension to this research. Like other research groups in the faculty and in health research, we think the user voice is an important one to hear, to recognise, and to learn from, and to learn with, and to involve in the research process. So it's going to be particularly interesting to me to hear from one or more of you this afternoon, and I know there are many of you in the room, and we're delighted to have you here. But first, however, enough from me, and it's my great pleasure to introduce Professor Richard Bentall from the University of Liverpool, himself a very distinguished figure in mental health research. So, Adam, Steve, Fiona, other colleagues, thank you very much for the opportunity to introduce this landmark event. Thank you.